going to talk about basics of active surveillance of renal mass. I don't have any disclosures. The objectives today are to understand the principles for active surveillance. We're going to talk about biology, patient selection, outcomes, follow-up. And I really want to make the focus understanding data that you can actually just take to your patients and have a good conversation about how to proceed for patients that have renal mass. And then understanding the clinical applications of surveillance. So let's start off with talking about the biology of small renal mass. If we're looking at growth, this systematic review from 2018, we can see that most small renal masses grow very slowly, and even in the subset that is biopsy-proven RCC, they tend to grow very slowly. Higher growth rates in the intervention group suggest that the growth is what prompted the intervention. However, it's important to keep in mind that both benign and malignant lesions can grow at similar rates, they can grow not at all, or they can actually shrink. So we all know that growth rate is not a great proven surrogate for aggressive or malignant disease. If we look at grade, in this fairly recent systematic review of renal mass pathology, we can see that most masses less than 4 centimeters have very low to low malignant potential. There's basically the chance of metastasizing approaches 0. Regardless, small renal masses are removed routinely without preoperative pathologic diagnosis. And this raises the question of significant overtreatment, unnecessary morbidity, and cost. And you can see on these diagrams up to 90% of renal masses less than 4 are very low malignant potential, and with up to